So, very good afternoon to all of you. Myself, Dr. Divesh from India. I will be presenting my original research paper, that is correlation of various physiological parameters with vitamin D levels among adult females of Chandigarh, India. So, I am delighted to participate in the World Anthropological Union Congress happening at Johannesburg 2024. So, what is happening? Vitamin D plays a significant role in maintaining the blood pressure also. How? Because when the vitamin D level is low in the blood, the level of cortisol will increase in the blood. And what this cortisol will do? This cortisol is basically a vasoconstrictor. Vasoconstrictor means what? It will harden, it will stiffen the walls of the nerves. It will stiffen the walls of the arteries, veins. So it will hinder the smooth flow of the blood throughout the body. Hence, the heart will feel pressure in pumping the blood, and hence the blood pressure will increase. India being a subtropical country, we have abundant sunlight, and still we have a great amount of deficiency present among the population. In my research on the Chandigarh population, approximately 64% of the females were vitamin D deficient, and around 24% of males were having vitamin D deficiency. And vitamin D deficiency is a global epidemic, or we can say it is a pandemic, and it is a silent killer also, because vitamin D plays a significant role in maintenance of the optimum health of a person. It is also responsible for the longevity of the individual. So I will start my presentation. Now, vitamin D we get from various resources. The most prominent is sunlight, that is ultraviolet radiation. Now, what is happening? There is a proper balance of the vitamin D level, parathyroid hormone. When the vitamin D level is low, parathyroid hormone level increases in the blood. And what this parathyroid hormone do? This parathyroid hormone definitely starts deteriorating the bones. The bone mineral density will start to deteriorate if the PTH level or parathyroid hormone level is higher in the body. The person will become prone to osteoporosis. Now, there are various vitamin D receptors which are present inside our body. Approximately, it has been found that 36 tissues contain the vitamin D receptors, and at least 10 other tissues outside the renal proximal tubule also contain enzyme 1 hydroxylase. Numerous observational and interventional studies have concentrated on determining the role of vitamin D metabolites in the emergence of hypertension, because inappropriately high RS activity contributes to hypertension and cardiovascular risk. I have described earlier in the brief introduction the ability of vitamin D to negatively regulate the renin-angiotensin system is most prominent mechanism linking it to hypertension. The present study aims at assessing the correlation of the various physiological parameters with the vitamin D levels among the adult females of Chandigarh, India. Since there is a dearth of information on vitamin D levels in the adult females of Chandigarh, the current study will assist in determining the relationship between the various physiological indicators and vitamin D levels among adult females. Material methods. The present study was conducted with an objective of assessing the correlation of vitamin D levels with various physiological parameters such as systolic blood pressure, diastolic blood pressure, and pulse rate among adult females in Chandigarh, which is also the capital of Punjab and Haryana. It was actually, the sample size of females was 295, age group ranging between 30 to 70 years. Informed consent were taken from everybody. For the measurement of the systolic blood pressure, diastolic blood pressure, and pulse rate, Omron automatic blood pressure monitor MX3 Plus was used, which was based on the oscillometric method as suggested by British and Irish Hypertension Society. It is an electronic oscillometric device with a capacitive pressure sensor designed to measure pressure in the range 0 to 299 mmHg and pulse rates in the range 40 to 180 beats per minute. There was a gap of 3 minutes between two successive readings. and CLIA method was adopted for the estimation of the vitamin D, and the vitamin D levels were categorized into three zones, that is normal range, that is from greater than 30 to 100, vitamin D insufficiency range, that is 21 to 29, and vitamin D deficiency range, that is 0 to 20 Ng per ml. Now we have assessed the daily level of physical activities. Additional information of the vitamin D supplements, calcium supplements, multivitamin, and awareness of hypovitamin D was also recorded. The details regarding the type of food intake, vegetarian, non-vegetarian, and vegetarian, were obtained from each participant. Informed consent was taken from each participant, and ethical clearance for conducting the study was obtained from the institutional ethical committee. Exclusion criteria very important. Participants with chronic liver disease, prolonged illness, a history of corticosteroids medication, hormone replacement therapy, pregnancy, and any other record or history of surgery were excluded from the study. Static SPSS was used, and for calculating the differences in the categorical variables, that is normotensive and hypertensive, the participants were computed using chi-square test. Carr-Pearson coefficient of correlation was calculated using SPSS. The level of significance for all analysis was set at P, that is smaller than 0.05, and confidence interval of 95%. Results. Now here we can see the categorical differences was significant for the category of the normotensive hypertensive in the level of physical activity, okay, and no prominent categorical differences were observed for the other parameters. As we can see, the value of the P was less than 0.05 for only for the level of physical activity between the normotensive females and hypertensive females. In this one, we can find that the categorical differences between the normotensive and the hypertensive females were significant only for the intake of fruit. Now correlation. The Carr-Pearson coefficient of correlation for different categories of vitamin D levels with the physiological parameters of the female. Now here we can see that in case of this one, the normal and deficient means vitamin D normal females, vitamin D deficient females, and overall. So we can see the level of significance or the significant association was not reported in any of the categories. Either they were normal females, normal vitamin D level females, and vitamin D deficient females. Discussion. The present study was a cross-section study. In this study, there was no significant association reported between the vitamin D level and the systolic blood pressure, diastolic blood pressure, and pulse rate among the vitamin D normal females and vitamin D deficient females. Q et al. In study reported that there is no significant association between the hypertension and blood pressure in the individuals who were having normal level of vitamin D, which was in accordance with our present study. Chan et al. Found a non-significant association between serum level of vitamin D and blood pressure among the women. In present study, no association was reported between serum vitamin D level and blood pressure, but prior experimental and population-based research have proposed different pathways to define the relationship between serum level vitamin D and blood pressure. The mechanism of this action may include the capacity of vitamin D to adversely regulate the renin-angiotensin system and its relationship with endothelial vasodilator function. Actually, it is I told earlier that vitamin D definitely good level of vitamin D decreases the level of cortisol, and cortisol is a vasoconstrictor. This whole system is about that. There are various studies which had shown that individuals residing at higher latitudes receive lesser sunlight and hence lower level of vitamin D, which is associated with blood pressure level. A study on the older population of United Kingdom described no significant association of the vitamin D levels with the systolic blood pressure and pulse rate. The dark pigmentation of the skin lowers the capacity of it to synthesize the vitamin D from the available sunlight, which was found to be associated with the blood pressure. Conclusion. The diastolic blood pressure and pulse rate were negatively and non-significantly correlated with the vitamin D level among the females present in the vitamin D normal category. Systolic blood pressure and pulse rate were found to be negatively associated with vitamin D level among the females present in the vitamin D deficient category, but the association was non-significant. There was no significant association reported between vitamin D level and any physiological parameters among the females in our present study. More prospective studies and large randomized controlled trials are needed to confirm the association between the vitamin D, systolic blood pressure, diastolic blood pressure and pulse rate. Also, more studies needed to find out if the correlations that have been found hold true for other populations. Thank you.